So we stopped here. This is the blood vessel supplying to the kidney. Okay, so the blood vessels are lined by endothelial cells. Okay, so we are going to discuss now about a concept called septic shock. Okay, in septic shock, so first of all, there is septicemia. Septicemia means bacteria or any microbes in the blood. Okay, that is called septicemia. So for example, if the gram negative bacteria, why I am specifically telling gram negative bacteria is very dangerous than any other things. Okay, so when the gram negative bacteria enters the circulation, or when the gram negative bacteria creates a very severe form of acute inflammation, okay, the cytokines released are TNF and interleukin 1. You all know this cytokine. It is released in the acute inflammation. When the acute inflammation starts, what they do is they will do vasodilation and increase the vascular permeability. So when it happens, what happens? The fluid goes out. When the fluid goes out, not only fluid goes out, because of increased vascular permeability, the protein also goes out. Okay, see, the protein also goes out. This all happens all over the capillaries. Okay, all over the capillaries, because it is in the blood. The septicemia is happening and the infection is in the blood, and this cytokines are more produced in the blood, and this is leads to what? Severe form of edema and protein going into the fluid, happening all over the capillary areas. Understand? All over the capillary bed. When it is happening like that, when the protein also going out, they cannot bring back the fluid. Okay, they cannot bring back the fluid. Why? Because the capillary colloidal osmotic pressure is reduced. It is reduced. Okay, and because of this, there is decrease in plasma volume. Understand? Because of this, there is decrease in plasma volume. When there is decrease in plasma volume, that is otherwise called as decrease in blood volume, circulating blood volume. Okay, so when after that this TNF and interleukin 1, they will damage the endothelial cells. They will damage the endothelial cells. When they damage endothelial cells, the endothelium exposes the subendothelial zone, and 1 millibrand factor are shown. Automatically the platelet will come and bind, and they will form the platelet plug, and they form the thrombin. Thrombosis is formed, right? The thrombosis is formed. Once the thrombosis is formed, it is going to create ischemia, right? It is going to create ischemia. Okay, so it is creating ischemia. Meanwhile, the blood flowing to the in just below the thrombi in the obstructed capillary, it will be fast or slow? It will be fast. When the, it will be fast. If you close the pipe in the halfway, the flow will be fast. Same mechanism here. Okay, when the capillary is occluded in half, so the flow below will be very fast. So this is very sticky. Okay, this is like a gum. The thrombi is like a gum. When the RBCs see the thrombi, they will attach to the thrombi. Okay, because it is very sticky, RBC will get attached. When RBC gets attached, because the flow is also very fast, they will pull the RBC. They will pull the RBC, and the RBC will break. Understand? The RBC will break. This happens all over the capillaries. Okay, this is happening all over the capillaries. See, I am going to give you a name for this process. It is happening in the capillaries, right? Capillaries is a very small blood vessel. Capillary is a very small blood vessel. If it is small, we call micro. Blood vessel we call angio. Microangio, because the RBCs are broken down, it is called hemolytic. Hemolytic. When the RBCs are broken down, it will create anemia. Okay, it is called microangiohemolytic anemia. Commonly we call it as MAHA. Okay, MAHA. So it is microangiohemolytic anemia. Understand? So when the microangiohemolytic anemia is formed, the quality of the blood carrying oxygen carrying capacity is less because RBCs are broken. RBCs are broken, so it will lead to hypoxia. It will lead to hypoxia. Okay. Another problem happens is now this thrombi is forming all over the body, right? And more thrombi is forming, more platelets are used, more clotting factors are used. Understand? More platelets are used, more clotting factors are used. So now I'm asking a simple question. What will be the level of platelet and clotting factor in the blood? Whether it will be increased or decreased? Who said increased? Who said decreased? It will increase or decrease? Increase. Decrease. Okay. So you understand why it is decreased? Because it is used. Because all the thrombi uses the platelet, uses the clotting factor. So the available platelet and clotting factor will be reduced. The platelets are reduced and clotting factors are reduced because all goes to the thrombi. Understand? All goes to the thrombi, automatically get reduced because but this TNF and IL-1 is keep on going up because of the gram negative bacteria. Understand? So if the blood vessel gets damaged here, okay, they cannot clot, right? Because platelet and clotting factor are reduced, so they will bleed. Understand? They will bleed. So it will again reduce the plasma volume and they will go for severe hypoxia. This too will lead to severe necrosis. Okay, this all happens in the multiple organ. They will go for multi-organ failure and they will go for death. Understand? So the main problem here is the gram negative sepsis or gram negative septicemia creating severe form of acute inflammation. They are increasing the interleukin 1 and TNF. They will damage the, first of all they will create the edema that will reduce the plasma volume. After that they damage the endothelium and they form the thrombosis. Okay, and because of the thrombosis the RBCs will attach. Because of the force of the flow they will get ruptured, so they will produce microangiohemolytic anemia, so that will create a hypoxia. And because they are more utilized, the platelet and clotting factor are reduced in the blood, so that will lead to bleeding. So these are the points you should remember. In septicemia, gram negative sepsis, what happens? There is increased TNF and IL-1 that leads to what? Acute inflammation. In acute inflammation, what happens? Vasodilation, increased vascular permeability. Okay, when this happens, that will reduce the plasma volume. Plasma volume is reduced. Then they will damage the endothelium. Endothelial injury. This endothelial injury will lead to thrombosis. This thrombosis is using all the platelet and all the clotting factor, and they will reduce the platelet and they will reduce the clotting factor in the blood. So that will lead to bleeding. Again this will reduce the blood volume. Okay, so basic thing happens here is this endothelial damage or endothelial activation, understand, because of the sepsis. Okay, so this is called septic shock. Okay, the septic shock, if you take these three types of shock, what is that? Cardiogenic, hypovolemic and septic shock. This is very dangerous. 75% of the patient in gram negative sepsis will die. 80 to 90% of the patient in these two shocks we can save the patient. Okay, this is a big difference, exactly opposite. Okay, so septic shock handling the patient is very difficult because this whole event happens very fast. The whole event happens very fast and it is very difficult to control the event. The main point is we cannot control the event. Okay, so only thing, if we can able to remove this gram negative bacteria, then we can able to control the event, because until it is there they will keep on secreting the TNF and what, IL-1 and IL-1. Let's go to the handouts. We have to start from infarction, right? Okay. You all can see, read, right? Okay, because it is recording. Okay, so infarction is an area of ischemic necrosis caused by a occlusion of any blood supply, artery or venous. You understand this? It is a necrosis caused due to the occlusion which creates ischemia that leads to the necrosis. Okay, so 99% of the infarction are from thrombotic or embolic events. There are two types of infarct, red and white. Okay, mainly the red infarct happens when there is venous occlusion, or there is loose tissue like lung, with dual circulation like lung. Okay, lung has two circulation, understand. So white infarct happens if there is arterial occlusion or in a solid organ such as heart, spleen, kidney. Heart, spleen, kidney. The infarct will be white in color. It is called white infarct. Okay. And septic infarct happens when there is bacterial infection and they will form a abscess. Okay. Okay. So all infarcts tend to be wedge. All infarcts